All, my name is Parvathy. I am a registered nurse working at the emergency department of a hospital. Today I am going to share you one of my experience. It's a positive experience. Day before yesterday, I had been allocated with a patient, Mr. Tom Brooks, 54 years old, had taken to the hospital by his wife with the chief complaints of chest pain. He had severe chest pain because he gives me the score 8 out of 10 for pain scale reading. He was very pale, sweating and continuously grabbed his left side of the chest. And he said me that his pain was radiating upward towards his jaw and radiating downwards towards his left arm. So I confirmed that it may some cardiac related problems. So I decided to take a family history. After detailed history taking, I almost confirmed 90% that it is some cardiac related problems because he had so many risk factors for that. The first one is his family history. His family history shows that he had a family history of heart attack for his father, had a family history of stroke for his mother, and his uncle has also undergone a cardiac surgery followed by a heart attack. And they were all within 55 years of age, just like Tom. And the next one is his obesity. His BMI is 29 and his waist circumference is 100 cm. This is directly proportional to sudden cardiac death or ischemic heart attack or other heart failure problems. And the next is his stressful work environment. He didn't give time for any other physical activities other than playing saucer. And he is a hypertensive patient. As per some studies, MI is 30% higher in hypertensive patients than normotensive patients, and he is also a hypoglycemic patient. And his wife also shows me some of the pathology reports he had taken 2 or 3 days before. In that blood reports, his serum cholesterol, serum triglyceride, LDL and HDL level is also increased. This gives the risk factor for accumulation of plaques in the coronary arteries that may directly lead to heart problems. So I decided to take an ECG and blood for cardiac markers test and prepare the patient with the 2 large IV cannulas. After the ECG, my confirmation comes true because he had ECG changes in the ST segment of V3 and V4 leads, and his cardiac markers are also increased, that is troponin I and troponin T are also increased. This is anterior wall MI, that is anterior wall myocardial infarction. As a first aid treatment, I gave him aspirin 300 mg because aspirin helped to lyse the clot formation, and then I give sublingual nitroglycerin. It will increase the diameter of the coronary arteries, thereby increasing the blood flow to the heart. And I also arrange IV morphine as an analgesic agent if needed. Then I transfer the patient to for percutaneous coronary intervention such as coronary angioplasty. He had undergone coronary angioplasty through his radial artery, and 2 blocks were found and 2 stents were placed in his left anterior descending artery. I am so happy by this because my confirmation or my assessment comes true, and I am able to identify the patient with the correct diagnosis. It may be due to my clinical experience, professional knowledge, or otherwise my proper history taking. Thank you.